I'm Shevaun Doyle, and I am a pediatric orthopedic surgeon. One of the magical aspects of my job as a pediatric orthopedic surgeon is I get to see a broad age range, right? Babies that are literally days old to kids that are just about to go off to college. So part of the fun is the different demographics. I do treat a fair amount of deformities that can occur in utero, such as clubfoot, metatarsus adductus, and hip dysplasia. That's a lot of what I treat in infants. I also treat deformities such as scoliosis in sometimes young children, but mostly pre-adolescent and adolescent children. Additionally, we treat a lot of fractures. I treat a lot of fractures. Some are easy to treat in that patients either need a cast or a brace, and then there are others that require surgical intervention. My approach to patient care is engaging the patient right away. If they're old enough to speak and talk about their ailment or their injury, I like to focus on the patient and get their story and what they're feeling. Of course, the family will chime in, but I keep it focused just on what the child has to say and really get their story, and then from there have the family members help. I'd also just like to add that I really feel that it is a privilege to treat children and have their families trust me. It's often a vulnerable situation that I become an immediate part of, and I recognize that that's a privilege every time, and I try to carry out every day respecting my patients and their families and giving them the most therapeutic and comprehensive orthopedic care that I can. One of the greatest feelings about being a physician, surgeon, is when your patients are better after you've treated them. They often come to you when they are in pain or injured and unable to walk, and to be able to get them back on their feet and back to their sport or their activity, pain-free, and they come in and for checkups. It's just one of the best feelings that you can have professionally.